Welcome to Justice Talks with Jennifer Burton, where we talk about legal matters that impact your life and your community issues that help you live the best life. The information presented on Justice Talks with Jennifer Burton should not be considered to be formal legal advice nor the formation of a lawyer-client relationship. It's time to talk justice. Now here's your host, Jennifer Burton.
Welcome to Justice Talks with Jennifer Burton, here on the News and Talk of East Tennessee, News Talk 98.7 WOKI. Thanks for tuning in this evening. I'm your host, Jennifer Burton. Justice Talks is a news talk radio show, and here's what we talk about. We talk about anything and everything that affects you as East Tennessee residents. We discuss things from what the Vols are doing on the football field and the basketball court and the baseball, softball diamonds, through different health events in the community, things that make your life better. We've done shows on real estate, different legal issues, really just anything that affects your daily life here in East Tennessee. And we have had a number of different amazing guests, and we're so blessed and fortunate that they continue to want to be on our show and spend time with me and just kind of talk about things that affect different people here in the community. The show's relatively new, so what the show really means to me is that I get a chance to kind of flex a little bit of those sports journalism dreams instead of just being a lawyer, which is kind of boring. So I enjoy being here on the show. I get to meet new people from all across East Tennessee and just get to know what they're about, what affects their daily lives. It's a great, just kind of a variety show, and I'm so blessed that this opportunity came about here on News Talk 98.7. I am an attorney by trade. That's what my actual profession is. That takes definitely about second chair to my number one profession, which is being a mother to two amazing children. I have a 4-year-old and a 7-year-old, and they were both born here in Knoxville and are active in the community, go to school here in Knoxville, play athletics, do dance, do the whole 9 yards, everything that, kids that age get to do here in Knoxville. Also, we attend church over in South Knoxville. We live in West Knoxville. I work in Maryville and Sevierville. So really all over East Tennessee. And I just love getting to meet different people and kind of see what they have to say and see what affects their daily lives. And so this show has just been a really amazing opportunity for me personally. I have a law firm, and our corporate office is located over in Maryville, Tennessee. That's where the headquarters is. We also have a little satellite office up in Sevierville, and we travel all over. We go as far north as Bristol. We go as far west as Nashville. And I think as far southwest as I've been is Marion County. For any of you listeners out there who've ever been through the Jasper area, we travel that far as well. And just really great. Small town law firms have really changed in their dynamics with the invention of the internet and the cloud and different things that we're able to do technologically to help us better serve our clients. And our firm, kind of what our motto is that we want to be your family's law firm. Not your family law firm, but your family's law firm. And what that means is we like for our clients to be able to call us and say, hey, look, my son or my daughter has this issue. Can you help us? Had somebody call last week that said, listen, I'm looking for a pediatrician. Do you know anybody in the area? And so we really are very fortunate to keep those a real relationship with our clients. So we really pride ourselves in that. And we pride ourselves in keeping that small town feel, even though we've been blessed and fortunate to grow and be all across East Tennessee. If you ever have a legal need, you can always reach us at burtonmckinnish.com, or you can call us at 865-233-1105. You can always email me directly. I know my producers probably hate me giving out my personal information on the news air in case I get flooded, but you can always email me at jennifer@burtonmckinnish.com if you have any questions, or if you just have a topic that you would love for us to talk about. Like I said, we've done different shows. We've done shows on healthcare issues. We've done shows on how to sell your home. We've done shows on different entrepreneurship issues, and we're kind of growing out of the baby stage. Now we're kind of in the toddler stage of the show, so we're starting to do a little bit better. Today we are going to have an amazing show, and I am so excited. This is a topic that is near and dear to my heart, both from a personal perspective with family members that have struggled with this addiction issue, also just as a practitioner. We do a lot of adoptions at Burton McKinnish. We do a lot of custody matters in our firm, and a lot of what we see are family members that are raising children due to the opioid crisis, where parents are unable to kick this addiction that so many in our community. And I don't think that there's going to be one person listening to this radio show who doesn't know someone who has either personally been affected by the opioid crisis or has not seen the effects of it in their community. It's far-reaching. It knows no socioeconomic bounds, unfortunately. It knows no racial bounds. It is a very, very harrowing hurdle that we face as East Tennesseans. And, one of the things out there, and there was a politician one time that was running for president, and I don't know what anybody's political leanings are listening, but that said, all politics are small town politics and start local. And I think that's so true. So we have a guest on today who is going to talk about what we are doing here in Tennessee. Our guest today is Karen Pershing. She is the executive director of the Metro Drug Coalition. She's going to tell us a lot about what she does. She has over 30 years of experience with public health. And she's been in the East Tennessee area and is doing some amazing things. And I'm so excited to have her on the show. She is a Vol fan, I learned right before we started taping. So her roots run orange just like mine, which we're excited about. And so we're going to bring Karen on today, and she's going to talk about, just the growing opioid epidemic and kind of what we can do, what you can do as listeners, what we can do as a community to kind of help combat that. And I think it's something you may say, well, look, I don't have an opioid addiction. It doesn't affect me. That's not true. It affects everyone, from our local and state police to our school systems to our healthcare systems. This opioid crisis, I know we've seen a lot about it in the news. Bob Yarbird is showing it last week. If you watch WBIR, they've done a lot of coverage on opioid crisis. So it has been in the news on a local level, on a national level. If you have a family member affected by it, please feel free to email me, and, I will put you in touch with the right people to try to get to a rehab facility if they're willing and ready to go. If you have questions about anything we talk about today, again, please feel free to reach out to me at jennifer@burtonmckinnis.com. And if you have a question that I can't help you with, I will put you in touch with somebody who can. This opioid crisis is just so far reaching, unfortunately. And it's not something that any of us, I don't think growing up, any of us even knew the word opioid. I know I didn't. But now it's so widespread. And so we are going to bring Karen Pershing on. She's going to join our show today. Karen, I'm going to bring you in now. Karen Pershing, it is so nice to have you on this show. And I know you have about 12 balls in the air that you're juggling. So the fact that you took an hour out to be with us is such an honor for me. Thank you for coming on tonight.
Well, thank you. It's great to be with you.
Well, Karen, give us a little bit. We've got an hour-long show. We've got a lot to talk about and to cover, and it's going to go quickly. But give us a little bit about your background. Tell us who you are and kind of what your role is.
Sure. I actually have a master's in public health degree from the University of Tennessee, and began my career in 1986 at the Knox County Health Department. And public health has really prepared me well for the position I'm in now at the Metro Drug Coalition. I've been in this position since 2010, and I can tell you the public health educational background and experience I had has really been valuable in the way we're addressing substance use disorders in our area, not just in Knoxville and East Tennessee, but statewide and as a nation. Being able to look at it from that 300-foot view, and not get stuck in the weeds, so to speak, which can happen pretty easily. But how can we move this marble, the larger problem more quickly? So if we look at it from a system standpoint, we can actually have greater impact than if we're just dealing with one individual at a time. And so we look at what are those associative factors that are involved in substance use disorders, and how can we address those?
Karen, how did you personally become interested? You said you worked for the health department initially. How did you become interested in this issue?
Well, I think most people, if they will admit to this, have had friends or family members who have struggled with substance use disorders, and our family is no different, my family of origin. And so knowing the impact that has on not only that individual who's struggling with the issue, but that whole family. And, of course, in our community, when you're looking at a community, families are what makes up our communities. So if we don't have strong, healthy families, or we have families that are struggling with these issues, it's going to impact all of us, like you said in your introduction.
Right.
And so we really look at this as a community issue and not just something that affects one or two people.
It is. And I think it truly is a community issue. And I think it's so easy for us as East Tennesseans to put on blinders and say, well, my child doesn't have an opioid issue or my family member doesn't. So this doesn't really affect me. I'm not going to really pay attention when it comes on the news. But like you said, it does affect so many different areas, and it is a community issue. So tell me a little bit, what does the actual Metro Drug Coalition, kind of what do you guys do?
Well, we have been in the Knoxville community now for 33 years. And we were chartered actually by city and county government officials back in 1986, really to be that hub of information and to be that gatekeeper, so to speak, around substance misuse issues. And so what we do is we bring together, multidisciplinary stakeholders, because again, this is not just one sector's issue. It's a healthcare issue. It's a criminal justice issue. It's a family issue. It's a neighborhood issue. And so, we've got to make sure that all sectors of the community are engaged in this. And so MDC plays that role in being that convener, for those multiple disciplinary stakeholders to develop plans around substance use and how it's impacting our community, and all work towards common solutions.
Karen, we've got to take a quick break here on East Tennessee News and Talk 98.7 WOKI. But listeners, hang on. We'll be right back, and we are going to talk more with Karen Pershing, the Executive Director of the Metro Drug Coalition.
You're listening to Justice Talks with Jennifer Burton here on News Talk 98.7. Burton McInnish can be found online at burtonmckinnish.com or by phone at 865-233-1105. And now back to your host, Jennifer Burton.
Welcome back to Justice Talks with Jennifer Burton here on the News and Talk of East Tennessee, News Talk 98.7 WOKI. Thanks for tuning in this evening. If you're just joining our show tonight, I'm the host, Jennifer Burton, and tonight I'm honored to be here with Karen Pershing, the Executive Director of the Metro Drug Coalition. Just before we went to break, Ms. Pershing and I were discussing the purpose and kind of the overview of Metro Drug Coalition. So, Karen, I'm going to let you go back and kind of explain what the coalition's purpose is. And you said that it began actually back in the late 80s. And so obviously their goals, I would assume, have changed as the opioid crisis. I don't think the opioid crisis opioid was probably not even a word we talked about until I would say the last 10 years, really. So kind of tell us how the coalition's changed over the years and kind of what their present goals are.
Sure. Back when we did start in 1986 is when crack cocaine was actually hitting especially our low-income populations in Knoxville. And so money was coming from the federal government for local communities to look at, how they needed to address the new crack epidemic. So, yes, your point is well taken. Over the years, the agency has had to really change and move with what the trends are and new drugs that have come on the market, new illicits that have entered our country. And so we're constantly trying to stay abreast of what's going on, which is why those partnerships are so important to us. In many cases, we'll hear about a drug coming into our community through law enforcement before anyone else will be aware of it. But our main priority, our main goal is to try to prevent substance misuse of any kind before it starts. So we really focus on the root causes of all substance misuse. So again, those root causes are the same, regardless of what the drug is. And so again, our focus is, maybe we're having an opioid crisis right now, but if we continue to move upstream what those root causes are, then we can address all drug use and not just a single type of drug. And that's what's really important in this conversation, is that we look at it globally.
Right.
And some of our most commonly misused drugs are legal substances, such as alcohol.
Right. And I think that you touched on something, and I've heard if you've done any kind of work, and I know there's some amazing things going on, like the drug courts that we have in the legal system, and just some things that I'm familiar with just by default because of my profession. But a I think if you look at this, addiction is addiction across the board. And so you touched on something that's so important. It's like, how do we get to the root of these issues? And like our firm, for example, does a lot of Social Security disability work. And so a lot of people are prescribed different drugs there. But it's like, is the drug the issue, or is it they have an underlying mental health issue that's the issue, or is it something, an unhealed hurt from the past that they're trying to dealing with this addiction? And so I think what you've hit the nail on the head, like the coalition trying to get to what's the root of the problem, because whether it's alcohol or whether it's, crack cocaine, which it was in the 80s, or heroin, which we saw a lot in the 90s, and I think is making a little bit of a comeback right now, or opioids, what is it that is causing people to turn to these substances in order to self-medicate or in order to heal or attempt to heal or mask what they're going through? So how do you guys work with, let's say, mental health providers, or how do you get to the root of those problems beyond, and rather than saying, okay, it's an opioid issue, is it really an opioid issue or is it an addiction issue? And we've got to get to the root of addiction.
Right. And the point you bring up, a lot of times people will call us, and because, again, opioids is the hot topic right now, can you come and speak to our group and do a training on opioids? And always accept those. That's part of what we do, is to go out and create awareness, provide education and training to any group in the community, whether that be through schools or civic organizations or businesses. We'll go out and do trainings. And so I usually pivot in the course of those trainings. So I may start out talking about opioid misuse because that's what they've asked me to talk about. But then I pivot and I show how, if we continue to just focus, like I mentioned, just on a single substance, we're really not going to solve the problem. Right. Because what our data is showing us is that because we've done such a great job at reducing the amount of prescription opioids available in our state now, we are seeing a shifting to illicit substances again. And heroin, like you mentioned earlier, is one of those. Right. But we're also seeing an uptick now in methamphetamine. We're seeing an uptick in cocaine. And so again, once people already have a substance use disorder, they're going to go with the most powerful, the purest, the most affordable drug that's available to them at the time. And so you're just constantly feeding that diseased brain.
Right.
And so it's imperative that while we clamp down on access points, that we also increase access to treatment. And in some cases, about a third of adults who have substance use disorders have a co-occurring mental health disorder.
Right.
Sometimes you don't know if it's the chicken or the egg.
That's what I was going to say. I've seen that a lot in my practice area, and we do some criminal work, and I've done more grandparent and relative adoptions than I can count, where mom or dad has an addiction issue, and a lot of it is opioid. We saw meth. I feel like meth was more probably 5 or 6 years ago, and opioids has been on the upswing. But a lot of times these parents, the biological parents who are no longer able to raise their kids because of their addiction issues, they do have these mental health issues, but it's like, which came first? Did they have the mental health issue and they used different substances to try to self-medicate, or have they used so many substances that now they have mental health issues? And so what do you guys do as far as kind of working? Which one do you treat first, or do you have to do it as more of a team approach and, okay, let's try to treat it together?
Yeah, it really has to be an integrative approach. Unfortunately, though, until you get someone off drugs for usually a minimum of around 6 weeks, if they've never been diagnosed with a mental health disorder, it's going to be very difficult to diagnose their mental health disorder properly.
Because they're altered anyway.
Yeah, they're altered from and behaving differently because of the drugs. And so, again, you've got to be able to tease those things out before you can properly diagnose. So integrated practices that have substance use disorder clinicians as well as mental health trained clinicians really can do a good job kind of tag teaming those patients who have those co-occurring disorders.
And one question I have for you, and this is just, I guess, more to help my clients and to help those out there listening that don't have access to health insurance. One of the struggles I see a lot of times, especially with my Social Security clients, is hey, we want treatment, we want to get help, but we don't have insurance. We don't have any kind of financial means to get help. Does the coalition, like, what do you do when you have somebody who obviously needs treatment, needs mental health treatment, needs to help deal with their addiction? I mean, what resources are out there in East Tennessee, good resources to help them move along and kind of, deal with their addiction?
Well, the state of Tennessee, because we're not a Medicaid expansion state, right, we do have higher rates of individuals who are uninsured who need help. And so they have expanded the mental health safety net, which has created more space and more opportunity for individuals who have behavioral health issues or substance use issues to have access to treatment, and to affordable treatment. In most cases, free treatment. Unfortunately, there are limits to that. Right. And so sometimes there can be waiting lists. But I think those treatment providers really try hard, to try to meet the need immediately and as swiftly as they can, because many times when people finally reach out for treatment, they're in crisis.
Right.
And so,
you're kind of at rock bottom a lot of times. I mean, I wish that it was the case that it was somebody dallied in it and then we're like, ooh, I'm going down a bad path. Let's stop now. It might be a little bit easier to deal with. But like you said, from what I've seen, it's usually I'm in jail. I've lost my kids. I've had a run-in with the law and I have nothing. So what do I do now?
Yeah, and that's unfortunate. And it's been real interesting to learn that everybody's rock bottom is different.
Right.
So sometimes I think their perception out there is that you've got to lose everything and go to jail and lose your kids before someone realizes that they need to get help. But I hear stories all the time of people who are going down that path and recognize it early. And the earlier you can recognize it, the better off you're going to be.
And that's so true, is catching it early. And I think, it varies, obviously, family by family, how involved they're going to be. We're coming up on a hard break here on News Talk 98.7 WOKI, the news and talk of East Tennessee. But please don't go away, because when we come back, we're going to continue to visit with Karen Pershing, Executive Director of the Metro Drug Coalition. We're going to continue to talk about what MDC is doing to assist in the fight against the opioid crisis, as well as the neonatal abstinence program, here on the News and Talk of East Tennessee, News Talk 98.7 WOKI.
You're listening to Justice Talk with Jennifer Burton here on News Talk 98.7. Burton McInnish can be found online at burtonmckinnish.com or by phone at 865-233-1105. And now back to your host, Jennifer Burton.
Welcome back to Justice Talks here on News and Talk of East Tennessee 98.7. I'm Jennifer Burton. I'm your show host, and I'm here tonight with Karen Pershing, the Executive Director of the Metro Drug Coalition. Karen, in the last segment, we were talking a lot about the opioid crisis, but we went into something a little deeper, which is the addiction that underlies, what causes an opioid addiction, or an addiction to cocaine, or addiction to alcohol, or any other number of drugs. So what, in your experience, have you seen that causes people is it people are born with these addictive personalities, or have they experienced some sort of trauma in their life that leads them to be more addictive, or, kind of, where does this come from? Because I think you touched on something so important, and you talked about, and I grew up in the 80s, and so I remember DARE, and I remember, I was little, but I can remember Ronald Reagan, just say no to drugs, and Nancy Reagan, and that whole campaign. And then, those are the memories that I grew up with. And my first recollection of introduction to saying no to drugs was the DARE program. And I think 4th or 5th grade in North Carolina, in our small little country school there, where, we didn't know what drugs were. We all went to church with everybody we knew. And, people that did drugs lived over in a different county on the other side of Asheville. So it was very stereotypical. But now, as an adult and doing what I do, especially with my Social Security work and with the family law, the adoptions and that sort of thing, I see such a huge impact of addiction and mental health and how they coincide and intertwine. So, addiction, where does the root come from? Is it something that we're born with? Is it something that can we do something earlier when kids are in school? I know that we see sex addiction, for example. Sex education starting earlier and earlier. do we need to do something different with our youth? I mean, kind of where do we go from this?
Well, let's really talk about, what causes people, I guess, to go down that path. There's actually 3 primary factors.
Okay.
So you mentioned genetics. And there now is, definitely a genetic predisposition towards substance use disorders. So, if you have people in your family with a history of substance use disorders, that could put you more at risk for developing one yourself.
Right.
And so that's a watch out.
And I knew that as far as like alcoholism is concerned. I have friends who, will say, I won't touch any alcohol because I have a parent that has it and it's just not worth the risk. So there's a genetic disposition that can be one factor, is what you're saying.
Right. And then you hit on another, which is trauma. And what we learned back in the late 90s, there was a study done out of Kaiser Permanente in California. And it was called the ACE study, Adverse Childhood Experience Study. And there's a lot of research behind this. There were over 100,000 different patients that were involved in this study. And it's a questionnaire that asks you 10 questions about your history before you turned 18. And this was asked to adult patients.
Okay.
And these were primarily, middle class people who were commercially insured. So they were working people like you and I.
Right.
So it wasn't, poor people, a TennCare population, anything like that. But what they did was they scored them. So you got a score of 1 to 10. So if you'd ever had any of these things happen to you, like sexual abuse, physical abuse, neglect, if your parents divorced, if you had a death of a loved one, during your childhood, those are the types, if you lived with someone with a substance use disorder, one of your parents, or if one of your parents had a mental illness, that was considered an adverse childhood experience. So you gave yourself a point for each one of those items. So you got your maximum score could be 10. And what they learned, if you had a score of 4 or more on that questionnaire, you had a much greater likelihood of having poor overall health. And your perception of your health was also worse. So when you ask, how do you feel about your health? You get those surveys all the time.
Yes,
and
you feel generally healthy.
Are you satisfied with your life? Do you feel happy most days? People with ACE scores of 4 or higher generally scored themselves lower on those questions.
Okay.
But they also had higher rates of cardiovascular disease, high blood pressure, cancer rates, all of those things. But what really stood out in the study is both mental health and substance use disorders. Those were the top 2 things that they identified in that population of diagnosis that were the most prevalent when they had higher ACE scores. So that is something, knowledge is power, right?
Right.
So we know if we can prevent and mitigate ACEs, we can't prevent every ACE that occurs with a child. I can remember losing a grandparent, as a child, which was traumatic for me, but I had a caring adult to walk beside me to help me process that grief. Right. And that's what's important with adverse childhood experiences, is having a caring, loving adult in that child's life that's trusted and loving and acknowledges their concerns when they're going through that particular issue, and not just ignoring it and saying, oh, they'll be fine. They're
I think
resilient.
That's so important. I know, just from personal experience, when I went through a divorce and we have small children, and our counselor, one of the things he said was, let your children talk about it. Let them talk out their feelings. Right. Give them some room to say when they're angry, when they're sad, ask questions, age appropriate answers. And I think you hit on that. It's so important to give children an outlet, and to also have a supportive, loving, caring adult. And, I see many grandparents, I say grandparents, sometimes it's aunts and uncles, but a lot of family members who step in when you have drug addiction, who are raising, their children, and they are great, supportive, stable homes. I think the struggle comes, what I see just from on an experience level in the legal profession, is when we have clients that struggle with mental health issues, and it's not severe enough for, let's say, a removal of the child, but you have a child in a home where there's somebody with a severe mental health issue, or there's someone with a severe substance abuse issue that goes unrecognized. And those children, I just wonder if they're going to be later on like the adults that you're talking about with the Kaiser Permanente study. Yeah,
and it's really tricky because, kids, regardless of, the living environment, sometimes, they just want to stay with their biological parents. And so it's really, really difficult. And again, that's an ace to remove a child too. Sometimes you have to.
Right.
I mean, you just have no choice. That environment is just extremely unsafe for that child. But if you can bring in supports to help that parent get better and create a more nurturing environment for that child, everybody wins.
Right.
In that situation. And I think we've kind of had this mentality in the past was, it's the parent or the child instead of really working with the family as a unit.
And that's one thing I see a lot, especially with the Department of Human Services and Department of Children's Services. They do their best, and I understand funding's an issue, and there's high turnover with our caseworkers. I mean, there's more than they can say grace over on a daily basis. So that's just a reality. But a lot of times what I see is, like you said, it's like parent or child, and it's not this collective coalition to, hey, let's try to keep this family together and keep this child safe. And how do we do that? And I don't know if that's lack of funding. I don't know if it's lack of education. I don't know if it's just the turnover rate. But I do see a lot of cases when I'm involved, when the department's involved, like on a juvenile level, a lot of people, their parents were involved with the juvenile court system back in the day. And so it's cyclical. And so it's like, how do we break that cycle? And I think MDC is trying to break that cycle by educating and working with different groups. But I mean, how do we get ahead of that?
Well, again, I think education is key in educating all stakeholders at all levels. So whether you're a parent, whether you're a teacher, whether you're a social worker, whether you're a hospital, a nurse in a hospital, or a physician, the court system, again, if someone comes before you and you kind of understand their walk and their journey, it can really help you try to figure out what to better do with them than just simply incarcerating them. We're incarcerating a lot of people who are mentally ill or have substance use disorders right now, which only makes matters worse.
That's what I see. I'm like, I see a lot of people in court, and I think they don't need to go sit and be incarcerated. They need treatment because they're not going to get better. They're going to be incarcerated, and whenever they get released, they're going to be right back where they were with no change, no life change for them. And so, how do we kind of stop that? And when we come back, I want to talk to you a little bit about drug courts and some of the other things, so that we can kind of touch on that. So we're up on a hard break, but stay tuned because we're going to come back and we're going to continue talking about drug court here in East Tennessee, how Metro Drug Coalition is working with that, what we can do for the people that do come into the system, how we can educate, how we can get ahead of that. And it seems like we have a huge mountain in front of us. It seems like there's a summit to climb. But the work of the MDC and also local law enforcement, I know they're trying to do a great job. And we do have some amazing, even up in the 4th Judicial District, Judge Dwayne Sloan's up there. I know you've probably dealt with him a lot and seen that. We have a drug court up there, and that is just such a huge opportunity to address the issue. And rather than just running these people through a system, they're going to be back in the system again. It puts a financial burden because you're having to pay public defenders, you're having to run them through the court system. And it just seems logical that if we can give them some help and run some programs that will really walk alongside these people, that maybe we can get ahead of it and maybe we can climb a little ways up that mountain. I know there's some great areas out here for, some support groups and things like that. So when we come back, I want to talk to you about some community resources that we have and just kind of finish up here in our last segment on News and Talk of East Tennessee 98.7, Justice Talk. Thank
you. You're listening to Justice Talk with Jennifer Burton here on News Talk 98.7. Burton McInnish can be found online at burtonmckinnish.com or by phone at 865-233-1105. And now back to your host, Jennifer Burton.
Welcome back to Justice Talks with Jennifer Burton here on News Talk 98.7 WOKI. I'm here with Karen Pershing, and we have had a great conversation this evening about addiction and some things that are affecting our community. And Karen, I'm so glad that you're here. I almost wish we had another hour. We were talking a little bit about drug court before we went to break, and you touched on something when we were on break about housing, recovery housing. I want us to talk about that because I know what I see with my clients a lot of times when they do go and get clean, they go to a rehab or they go through drug court, they get clean. And what tends to happen, and sometimes they go off, we see Teen Challenge and different programs. And then a lot of times what happens is they come back. They're right back in that environment. They have nowhere to live except maybe with a relative or a friend who was involved in that community where the drug addiction occurred. And then it is putting this newly recovered person in a very precarious location. So tell me a little bit about kind of how MDC is working with drug court and some options for people that, you know, have come out of the rehab process or are able to be clean, but are still what I would consider, you know, baby recovered. So they need a little bit more support. What's MDC able to do?
Yeah, one of the things I'd like for the listeners to understand is that substance use disorders it is a chronic disease. And so we're treating it right now acutely. Mm-hmm. So people may get 28 days in a program if they're on medication-assisted treatment, which is methadone or buprenorphine. You know, they may be in a treatment program longer because they're on those medications. But for an addicted brain to heal, it needs 12 to 18 months of sobriety. And so what's happening is you're taking someone who maybe has been in treatment for, 1 month or even 6 months, and their brains are still not well yet.
Right.
And so it's important that they are in an environment that will help support their decision to remain sober. And so what MDC has started doing is we started a recovery housing fund in September of 2018 because we were seeing a lot of people going, I want to go into a sober housing facility, but I'm not working. They'd lost their jobs, they'd been in treatment, or they'd been in the drug court or incarcerated, and they're coming out of that situation with no money. And so they need money for a deposit in order to get into a sober housing situation. Right. And so what we do, it's a loan program, where we'll loan up to $300. They have to make an application.
Okay.
And it has to be a recovery housing situation that, we know about and that we know is doing a good job, helping people. And then we can provide that deposit. Once they get into recovery housing, part of their responsibility is to get a job so that they can continue to pay the bill once they're there. But our loan program allows them to pay back even $10 a week, $10 a month, whatever it is they can afford until they can pay that $300 back.
So they're not met with this huge financial burden, because I do see that a lot where they come out and they're clean. And then it's like, okay, but I need a first and last month's rent. Well, that can be, I know in Sevier County, for example, anywhere decent is going to be, and by decent, that's not going to be right back in where there's going to be a huge drug population. It's going to be $700-800 a month they're going to have to come up with. And you've been in rehab, or you've been incarcerated, or you've been in the drug court program, you're not working. Or if you are working, you're working at a minimum wage job. You're not going to have that kind of back money to come up with. So I think that recovery program is awesome that MDC is doing. That's really good. I'm so glad that you're telling our listeners about it, because I know that can be a struggle for others. I want to talk a little bit tonight, just switch over to the neonatal abstinence syndrome. Everybody loves babies. We all like talking about babies.
Yes, we do.
I don't know many people that don't love babies. I joke, I'm like, I have to give them back when I hold them at church. But what the neonatal abstinence syndrome, what is it, and what is MDC doing to help these mothers? Because one of the things that I think is heartbreaking, and this is just from being in the juvenile system, is seeing these mothers who, their children are born addicted, and their children are taken. And it's like, okay, what are we doing now? Because now we have 2 lives that are with drugs in their system. But how do we have the goal, for those of you out there listening, statutorily the goal is supposed to be reunification. But reunification is never going to be able to be achieved when we have an addict that is repeating the process. So what do you guys do as far as dealing with babies that are born drug addicted?
Well, what we do, we actually have the Born Drug Free Tennessee campaign, which is education and awareness. So, what's most important to us is that if a woman does become pregnant, and she does have a substance use disorder, the best thing for herself and for the baby is for her to get into prenatal care and also addiction treatment as early in the pregnancy as possible. Right. Because if she can get that, prenatal care is the best predictor, early prenatal care, of a positive birth outcome, regardless of substance use or not. Just getting in the care that you need and making sure you're being medically monitored and that you're having healthy checkups, all of those things, is critically important to having a healthy pregnancy. And so, that's the number one goal. And again, getting into treatment and getting into a gender specific treatment program. So one that understands pregnancy and women and moms and what it's like to be a mom is critically important. It's very different to treat a female with a substance use disorder than it is a male. Oh, yeah. Because there are all those other factors that are involved. And many more women with substance use disorders have that history of trauma that we talked about in the previous segment. Okay. In fact, usually around 90% have a history of severe trauma for women. So these are very fragile women to begin with. Okay. And so it's important that, again, we try to do trauma-informed care for them so that we don't re-traumatize while we're trying to help. And so, again, neonatal abstinence syndrome, it happens when a baby was exposed in utero to opioids. And then once those opioids are removed at the time of birth, that baby can go through a predictable physiological withdrawal syndrome. If they're not addicted, they're physically dependent. Addiction is where you're intentionally using despite the negative consequences. Okay. And of course, the baby's not doing that. So I think it's really important that we make sure we understand that just because a baby was exposed because of the mother's addiction doesn't mean the baby is automatically going to have an addiction issue.
And if the mother has used drugs, and this is where, and I'm asking because I genuinely don't know, if a mother is using drugs and she's pregnant, can they give that mother who's addicted, can they give her some of the weaning off medications like methadone, or will that harm the baby?
Well, that's actually, right now, the national standard of care is to either give a pregnant woman methadone, or Subutex, which is buprenorphine, which is an agonist. It's better than having street drugs
in your body
that are up and down in terms of how much that woman is taking. So it's a controlled amount of medication that can be tapered throughout the pregnancy. Again, this is why it's so important that they get into a treatment program early. We do have Dr. Craig Towers, who has been conducting research over the last several years and is willing to wean pregnant women completely through his clinic and working again with the community addiction providers if that's the woman's choice and her decision. And he's been able to safely wean, quite a few hundreds now of pregnant women and those women have not had NAS babies. So again, that's a huge win for the baby and for the mom if the baby is born and it hasn't been exposed to drugs and go through the withdrawal symptoms that they have to go through once they deliver.
We've talked about our youngest, and we've talked about the people that suffer from addiction. What is there out there that the MDC provides? And we don't have a whole lot of time left, but what do they provide for our youth? Let's say, you've got somebody in middle school. Middle school is such a traumatic time. Sure. Your body's changing. Nobody likes you. What you wear is important. I mean, it's a horrible 3-year period. I hope nobody has pictures of me from that time period. But what in that age group, what can we do there to kind of get ahead before they're going into high school? Or what does MDC suggest there for our community and our schools, our educators?
Well, we do a lot of education with parents. Again, I don't think parents realize sometimes how critical their role is. And so we want to make sure parents are armed with information and what their role is. But then we also have a youth initiatives director who's actually in the middle and high schools and making sure kids are getting the most up-to-date, accurate educational information on substance use, and what they can do to prevent it. And again, we have, with our high school students, we have formed a youth Metro Drug Coalition. And this coalition is any student that's a high school student in Knox County can apply to be part of the Youth Metro Drug Coalition. And those students are actually students who have been personally touched by substance use. So it's a place for them to not feel like I'm the only one this has happened to. It's everybody in there has had a shared experience.
And inclusion is so important at that age.
It is. Yeah. It is very important. And so they actually help us design our prevention and awareness campaigns that we take into our high schools. So will this resonate with your peers? What kind of problems are you seeing? So we look at them as really helping us to design the information and the materials that we need to use in the middle and the high schools in Knox County.
That is such a good program. What you guys are doing, I've so enjoyed having you here tonight from the MDC just to tell us what all you guys are out there doing, what's available for our listeners out there. If you have any questions, do you guys have a website? How can they get in touch with you if they have questions?
Yeah, we sure do. Our website's very easy to remember. It's metrodrug.org.
Okay, guys, go to metrodrug.org. Karen, thank you so much for being here with us. Next week, we're going to continue our mayoral series tonight and be joined by the City of Knoxville mayoral candidate, Marshall Stair, about his vision for the future of Knoxville here on Justice Talks with Jennifer Burton next Saturday night at 6 p.m. here on the News and Talk of East Tennessee, News Talk 98.7. Have a great night.